My name is Courtney Curtis, and I'm a nursing student with Indiana State University. My PSA is on breastfeeding, and my population at risk would be new moms, but moms who are preparing to give birth and planning to breastfeed. My learning objectives for this PSA are to recognize factors that contribute to successful initiation and long-term success of breastfeeding. At the end of this PSA, I want my viewers to be able to describe advantages of breastfeeding for the mother and the child. And I would like my viewers to be able to identify resources for more breastfeeding education and support. I would like to direct you to take your PreTest. It is a 10-question multiple choice test, and it has information we will be going over and confirming throughout this presentation. So see what you already know, and we'll compare answers at the end. I also have a brochure here for you. This is just a screenshot of part of it, and it has lots of information in there about advantages of breastfeeding, barriers to breastfeeding, where to seek support, some more references, and more tips for successful breastfeeding on the second page. So we will go over all that information in this PSA, and we will refer back to those references at the end for where to get more information and support. So there are many advantages to breastfeeding that extend themselves to the mother as well as the baby. First is that it does provide all the nutrition babies need for the first year of their life. The American Academy of Pediatrics, they state that that's all the baby will need. You could give them just breast milk for the whole first 12 months of their life, and they will be able to thrive. You would not need to give supplements or formula unless your doctor or their pediatrician indicates for you to do so. But the breast milk has all the nutrients and hydration that they need. It also, in the breast milk, it provides antibodies to babies that will help them grow their own immune system and can help them fight illnesses. Information provided says that the mother's milk is able to adjust and compensate for the baby, giving them the antibodies that they need to help keep them healthy. Breastfeeding also decreases the risk of allergies in babies, and it is also safer to introduce allergens to babies while they are breastfeeding because of the support from the breast milk can help keep them from getting severe reactions to things. And this is one of the big benefits for moms. It does promote bonding between mom and baby, and it also can help provide postpartum support for the mom. There's a lot of happy endorphins that are released while you're breastfeeding, and as well as feeling that connection and bond to your child, it can really help moms fight off postpartum depression and postpartum anxiety. And it's also free. There's no cost to breastfeed. Skin-to-skin breastfeeding, you don't need bottles or any other parts and pieces. Of course, if you are pumping using bottles, there's a cost for that, but the breast milk itself is free. Unfortunately, there are barriers to breastfeeding for many people. They stem from a lack of knowledge about breastfeeding, poor support system, whether it's your family, your community, or your workplace, and many women do have difficulty pumping at work. Legally, your work must provide a safe, clean, and private place for you to nurse, so hopefully that's not a barrier to as many people anymore, but it does present itself for many women. And another barrier is also non-supported childcare. Unfortunately, some childcare providers are just not as willing to deal with breast milk, transferring it to bottles. You have to heat it in hot water. You cannot put it in a microwave, so it's just a few extra steps for childcare providers, and unfortunately some just are not as supportive as others. Tips for successful breastfeeding, other than establishing any barriers and how to overcome them. One of the main things you can do, one of the hardest things probably to do, is to relax. The more comfortable you are and the more relaxed you are, the easier it is for you and baby to get comfortable with nursing. And to help you do that, set up a comfortable place to nurse at home. Whether it's a little nook, a comfortable recliner, rocking chair, with a little table beside it that you can put things on, and just have a nice place, nice little blanket to help you get comfortable. I also highly recommend getting a nursing pillow to help you position and help hold the weight of the baby, especially in the beginning when you're still healing. It's very helpful. Breastfeeding the baby as soon as possible after birth. This can be pretty much immediately after they are born. Typically you want to do it within the first hour. It is natural for them to nurse, so they will actually be looking for the breast. So doing it and establishing that breastfeeding as quickly as possible really helps set you up for success. Through the duration of breastfeeding, having the baby sleep in the same room as you really helps, especially with night feedings. You want them in the same room but not on the same surface. I highly recommend them being in a bassinet, or as they get older, putting their crib or a pack and play in your room for them to sleep safely. And of course, be patient and flexible. It's a very natural thing that does not always come naturally. So trying different resources, different ways to nurse, and see what works for you. Be flexible. If what you originally thought was going to work doesn't, that is okay. There are so many options and resources out there to help you be successful. So prepare for successful breastfeeding. Get educated. Before the baby is even born, get the items you need to help you, like maybe your pillow, if you're going to need a pump, bottles, things like that. To get educated, to get this information, taking a class can be very helpful. If you have no idea where to start, what you need, or what you need to know, that is a great place to get information, and that will also hook you up with resources once you start breastfeeding. And have a breastfeeding plan. Know if you want to do skin to skin, prepare to do it right after they're born. If you know you want to pump, have that together. Just be ready, be prepared. It'll make you feel a little bit better. It's one of the few things you can kind of control when it comes to childbirth. So have that plan ready. And know where to seek support. Going to a class and getting educated will definitely help you find that information and keep it on hand for when you are going to be in the hospital and afterwards when you will be nursing your baby. So where to seek info and support? Many hospitals will provide you with a nurse's hotline, or your insurance may also provide you with this nurse's hotline. It's a phone number you call, and a registered nurse will answer the phone and can help guide you and give you information if you have any questions. This is not only a great tool for breastfeeding, but also for anything with your newborn. So it's a great thing to keep on hand. Lactation consultants. You can talk to them before you have the baby. They are a great key while you're in the hospital. I personally saw one 3 times while I was in the hospital with my newborn, and they can help make sure you're all set up and ready to go. And you can also see them after you leave the hospital, after the baby is born. There are breastfeeding support groups. You can find them on Facebook and in your local network, and they can also help with, making sure latching and all those things. They kind of reinforce the teaching of the lactation consultant, and they hook you up with moms that are in a similar situation to you that are local to you. And of course, online sources. There are a ton, and we will talk about that next. I do have your post-test ready for you. It is the same 10 questions that you answered before, so go ahead and check that out, and then compare your answers. See what you learned, if any of your answers changed. So last but not least, these are those online sources I've referenced earlier. The first is through the cdc.gov. It's a kind of resource library for breastfeeding. There are a lot of different interactive things you can click on to get more information. They have data and statistics, guidelines and recommendations, and where to go to get more information. There's a ton of ton of links, ton of information on that website. The other one, LLLI.org, it's La Leche League International. They literally have wrote the book on breastfeeding. They are an international breastfeeding support group. Their website provides a ton of resources internationally for you to check out, and they have a lot of support, a lot of good information to help you out. So check them out.